now recognize myself for questions. You know, by statute, that created the OPPR, as you mentioned, you're required to submit a preparedness outlook report within 1 year. So my first question is, do you believe your office is on track and properly resourced to deliver that? And maybe briefly, tell me in your mind what preparedness looks like.
Chairman Wenstrup, thank you very much. And our office is committed to a good faith effort to deliver this report and ensure that it is as comprehensive as possible. And as I mentioned in my opening statement, we're reaching out not only to federal departments and agencies, but also to state, local, county, industry, and other partners to collect any reports or assessments that they have provided or conducted so that we can include those in the final report and acknowledge not only the whole of government, but the whole of society nature of this response. We will deliver that report this year. I will freely acknowledge that there have been some challenges related to the current budget environment, which have slowed our work down a bit, but we have found ways to work through that. And as we've done that, and as we've reached out to partners across the country, what they've consistently shared with us is their perception of the value of taking a hard look at what happened over the last 4 years and capturing those lessons, as well as the remaining gaps that we've identified, so that we can collectively then discuss how best to mitigate the risks that those gaps create.
Will you have an opportunity to, or will you be looking at, say, what other nations may have done during the pandemic? Again, looking for maybe things that worked and didn't work, and I know that in some cases it's apples to oranges, but may be worth looking into.
Congressman, thank you very much. And I've had the great privilege in prior roles of serving as the United States representative to the NATO Medical Committee and working with other allies and partners in different roles. And those personal relationships with colleagues around the world have given me the opportunity to discuss with many of my colleagues around the world what their countries have learned. And as you said, each country has somewhat different experiences, but I think it is absolutely safe to say that in every discussion that we've had about this, some of the key themes that have arisen have been the need for a whole-of-government response and a recognition that a pandemic, by definition, is a global event, not solely a local event. It has to be addressed both globally and locally for those responses to be effective and as efficient as possible. So I continue to work with our colleagues across the Executive Office of the President and the departments and agencies so that we can collect as much information as possible from all of those stakeholders to inform the report that we'll provide later this year.
And we talk about a whole-of-government response. Do you think your office will have the ability to break some of those silos that tend to exist sometimes within our government and in an attempt to bring them all together?
Thank you, sir. And that is absolutely my commitment in a good faith effort, collaboratively, transparently, and inclusively to leverage the convening authority that we have to bring the key stakeholders within government together. And we were clearly charged to do that in the bipartisan language that created this office. The success will be judged by what happens in the next pandemic, and so I don't want to overstate what we've done in the last 7 months, but I am grateful for our colleagues across the federal government who have partnered with us and who have recognized the opportunity, as you said, to break down those stovepipes and find better ways to work together so that we're better prepared for future events.
Okay. So another question, based on what we experienced with 3+ years of the pandemic, what do you see, and again, on a very general level, what is essential to improving the quality and delivery of diagnostics, therapeutics, and other medical countermeasures? I mean, this pandemic tested us in every way because even with this particular vaccine, we know that people still got COVID, so therapeutics was very important. It wasn't just a matter of getting a vaccine and the story ends, but being able to treat those that maybe didn't get as sick, but to respond in that way.
Thank you, sir. And I'd start with one of the most important long-term investments that this country should continue to make is investing in our public health data systems and our ability to see outbreaks as they occur. The faster that we identify that an outbreak is occurring, the more quickly we can then move to developing the appropriate, safe, and effective diagnostics, therapeutics, and vaccines to mitigate the risk of that outbreak. So that ability to detect what's happening is the first step. The next step, as you described, is how do we build those capabilities and then ensure that they're safely and appropriately manufactured, distributed, and administered, and that we track the impact that they have on the outbreak as it's occurring. That's a tall order, but one that we're committed to achieving.